With regard to that item on working from home, can you see working from home, full policy of working from home being implemented?
I haven't received any advice to that end, and it's not something that government is actively considering at the moment. I think at the press conference last night, the NPHET team were being asked about a lot of different hypotheticals, and they were giving a view generally that given the case numbers right now, they would prefer people to be opting for the the safer option.
And is that appropriate? I mean, I have to put it to you because, you know, a lot of people also text the show quite regularly about NPHET and go, these are unelected officials. Are they the ones actually running the country? Is it appropriate that NPHET give views that they haven't run by government, that aren't necessarily government policy, and that they are that are put to them on the fly, maybe by journalists, and then they answer them and give opinions that may in fact contradict government policy?
I think
is that not a problem for people?
I don't think so. I think we need as much transparency and as much information out there as possible. Let's be very clear. NPHET don't make decisions. Government make decisions. NPHET advises.
But do they advise government or do they advise the people, Stephen?
Well, they're doing both. Yeah, so they advise me. Tony Holohan advises me directly, and I bring that advice to government. But I think it's absolutely fine. I think it's a very positive thing that our public health experts are seen out. That the media have access to them, that the Oireachtas have access to them, that the public have access to them, to put a lot of these questions to them. You know, you and I can discuss things, and the politicians can give views, and obviously politicians have to form government policy, but we're not public health doctors. So I think there is a very important role to hear from the likes of Dr. Holohan, Professor Butler, and many of the others there as well.
Okay, let's move on to perhaps Professor Butler and NIAC booster campaigns. We spoke earlier on the programme to Professor Christine Losher, immunologist, and she was talking about the booster campaign and the need for that to happen rapidly. An awful lot of people feel we are tardy in this regard. She herself pointed out that it took 2.5 weeks after the booster campaign was recommended by NIAC for it to start to be implemented. What is going to happen with boosters? We're seeing waning immunity. That's what it looks like. That's what it looks like more than anything contributing to this surge in cases, that and maybe seasonality and everyone being indoors again. What is going to actually happen with boosters?
Well, what's happening right now is that those who are higher risk have been given the green light for boosters, and that's already happening. So those
63% of people are in hospital with COVID just because of their age, not necessarily because they're high risk. So exactly. Why not boost the over 50s, for example?
Well, we're doing the over 60s now. We're doing immunocompromised, all healthcare workers, long-term residential care. We're looking also at.
I know, Stephen, but in the first round of vaccination, we did it in that order because we were rationing vaccines because we didn't have much access to vaccines, and we did them based on need. Now we're being told supply of vaccines is not an issue. So why ration them group by group? Why get to the over 60s and then go, oh, now we'll scratch our chins and worry about the over 50s? Why not say we've loads of vaccines, we know this is necessary, let's get on with it?
Because what NIAC is doing, and I think what they're doing is the right thing, is they're looking group by group and saying what are the risks of not being vaccinated, what are the risks of being vaccinated. So they're constantly looking at the impact of the vaccines, both in terms of the protection they give and any potential adverse reactions. So what they've done, obviously, is start with those who are most at risk. Now, it's important to say, Ciara, as you'll be aware, we're already moving on about 1.3, 1.4 million people in the country. Now, one area where I believed we could add a marginal benefit was to move from the 6-month guidelines to 5 months. The advice we got from NIAC said, typically it's 6 months after you get your second dose, but you can potentially do 5 months. So I met with the HSE yesterday and said, now let's move the 5-month gap and let's make that as standard. So we are moving through those groups quickly, and it's really important to say that it appears to be having a very positive effect. So the one age group where the cases and the hospitalizations are falling, which is fantastic, is the over 85 group, and we believe that's a combination of behaviours and the boosters.
Yes, and I think you're probably right. But they're the group that have been boosted, and I know you're saying you're weighing up for each group, risk and benefit. I think there's few enough people would argue that the risk to an over 50-year-old, outweighs the benefit in terms of vaccination. I can't think of any significant risk to people getting vaccinated in that cohort.
Well, maybe not, but what NIAC are looking at is adverse effects from large numbers of people being vaccinated around the world to be absolutely sure than when we ask people to get vaccinated or we ask people to go and get a booster, that we are being led by the best advice and it is safe as possible. And I just say this, Ciara, there's sort of a clamour for NIAC to move quicker and quicker and quicker. And I understand that. Obviously, we want boosters as quickly as possible. However, let's remember that we have one of the highest vaccine uptake rates anywhere in the world. One of the reasons for that is because people trust the science and they know and they trust that there's an expert group who are poring over the data to make sure that when it is time for them to get a vaccine, that it is absolutely safe for them to do so. So while some people may be frustrated, I would argue that we have been very well advised. And I think people take a lot of comfort from the fact that we have experts really poring over the data to make sure that the medical advice that they're getting on this is absolutely correct.
Okay. With regard to vaccine certs, there was a suggestion last night by NPHET that they would like to see them extended to places like gyms and hairdressers. Is that on the cards?
It's not. It's not advice I've had, and it's not something government is considering. Dr. Houlihan was asked outright for his opinion. Is it the kind of thing that he'd like to see? Is it the kind of thing that would make things safer? And of course, it would make things safer. The more the COVID pass is used, the safer it is. It protects the people who are using the service. It protects the people working in the service. But in terms of regulation or government policy, that's not something we're looking at the moment.
Yeah. A couple of other things. With regard to vaccine certs, should they expire? I mean, we're talking about boosting at 5 months or boosting at 6 months. My vaccine cert, I'll be 6 months post my full vaccination on the 4th of December. Should it expire then, or what should happen?
It's an interesting question, and it's not one that we are considering expiring on at the moment. One of the reasons is while
if you look at Waterford, Stephen, is what I'm thinking, the highest rate of vaccination, but the highest rate of cases. So clearly there's been some level of the vaccines expiring in terms of an immunity cliff.
It's unclear that there's a causal relationship between those two things in Waterford. But what we are seeing is that the evidence is showing that there's waning for mild illness. But when you come to more moderate and severe illness and hospitalisation, the evidence globally is suggesting that protection lasts considerably further than 6 months.
Yes, and
it is something we'll keep under review,
it does, but it seems
it's not something.
Yeah, serious illness we're still protected against, but transmission doesn't seem to be protected against, and low-grade illness doesn't seem to be protected against. And on that basis, transmission is not being protected again. Is it not arguable that more useful for entering a venue or engaging in any kind of social gathering, that antigen testing would be more useful now than, in fact, our vaccine certs, many of whom are over 6 months old?
No, I think the COVID pass and the vaccine... Yeah, and the vaccine certs are really, really important because they do provide the vaccines do provide additional protection against transmission. Not as much, obviously, as we would have liked and we would have hoped, but there is protection against transmission. But more importantly, it means that the people attending the event have a very, very high level of protection. So if someone is to go to the match this evening, for example...
But it is arguable, Stephen, that somebody with a negative antigen test is less likely to spread COVID now than somebody with a vaccine cert. That's a distinct possibility.
Maybe, but the person who is vaccinated or who has recovered and has the vaccine cert has a much higher level of protection.
They do, but they can spread it. And is that not part of the issue?
They can, but you're talking about spreading within a population if they're fully vaccinated, where there is a huge level of protection